Yes. Okay, so I want to take a quick survey. Who here has a cell phone in their pocket? All right, see, everybody's participating. Everybody feels good. All right, who has a smartphone in their pocket? All right, good. Who has or owns a tablet? All right. Who has ordered a burrito, pizza, or a cup of coffee from their smartphone? Excellent. Who's done online banking from their smartphone or their tablet? Excellent. And who has accessed health information or communicated with your healthcare provider using your mobile device? Right, a significantly lower number. But this gets to the important point about mobile health. Patients want to be able to use their devices that they're carrying around with them in their pocket to take care of patients. And what you'll see on the slide that comes up in a minute is that mobile health, you've heard many mentions of mobile applications throughout several of the presentations, is really part of our connected health vision. This is an opportunity for us to connect with patients exactly where they are, because most people carry their cell phone with them in their life spaces. You know, the average patient spends maybe 100 to 200 minutes with their healthcare provider face-to-face, and there's 525,600 minutes in the year, which if you've ever watched the musical Rent, you can always remember that information because they sing it over and over again. So it's good to be able to share that fact in talks. Anyway, so apparently I'm not plugged in. We will try again here. Start over. Here we go. Excellent. So it's up and now it's not. All right, I apologize for this. There we go. Perfect. So the cell phone is the largest technology platform in the history of mankind. There are 6 billion cell phone subscriptions in the world. There are not many more people than 6 billion in the world. And if we look at veterans who receive care in the VA, compared to veterans who don't receive care through the VA healthcare, compared to the population at large, essentially everyone, many people have a cell phone. 91 to 92% have a cell phone. The third set of data up there shows essentially access to a smartphone. 40% of individuals in the United States access the internet through the cellular network. Interestingly, at the moment, only 21% of veterans access the internet through a cellular network. But we know that that number is increasing and will continue to increase over time. In the context of that, we also know that our healthcare providers, team members, are using mobile devices. Within 6 to 8 months of the iPad being on the market, in a survey of 3,000 US physicians, 30% already owned an iPad, and 28% said they intended to buy one in the next year. 1 year later, about a year and a half after the iPad came out, 60% of US physicians owned an iPad, and 50% of those said that they'd used it at the point of care and found that to be a useful way to deliver healthcare. Between 2010 and 2012, the number of cell phone users who used their device to access health information doubled, so that 31% of users were using health information. And I did a quick calculation when you raised your hands, and it was exactly 32% of this audience that raised their hands. So you guys are leading edge individuals. So we in the VA have thought carefully about having an overall strategy within mobile health. And I think the value of, it's great to be able to order a burrito or pizza or coffee, or even to do online banking. Banking is an example that's more similar to healthcare. What's really useful about mobile applications is when they can securely connect to our back-end systems and help our patients take care of what they need to do when they need to do it, so that they can close the gap between where the expertise is and where the expertise needs to be. And to do that, there needs to be a significant architecture to assure that we can deliver data to mobile devices in a secure way, in a way that we can be confident that personal health information won't be compromised on these devices, but also in a way that allows our veterans and our healthcare team members to optimize their ability to manage health. So we have viewed our development of mobile health applications really in three areas. The first is essentially the technical stuff that needs to happen to make this secure. All of the work to be able to secure devices when they're used in the VA and to deliver applications in a meaningful way to patients. And then the rest of our work has been in veteran-facing mobile applications, that's that second tier, and at the top, provider and staff-facing mobile capabilities. And I'm going to go through just a brief tour of some of what we've been able to accomplish. And then you can look in more detail in the back at our table where you can see some of these applications live and play around with them after the session today. So we started with a pilot at the Washington, D.C. VA Medical Center in 2011, and in that pilot we looked at a lot of the security implications to be able to deliver data from Vista on a mobile device for providers to be able to use. And here's an example of that. This application, I was one of the pilot participants, has helped me many times. When I was at the playground with my kids and I got a call about a panic lab value from the laboratory, in the past I would have had no earthly idea the context of that information, especially if it wasn't a patient that I had seen over the past few weeks. The ability to pull out my smartphone or my tablet and look up the patient's name, telephone number, their contact information, what medications they're on, what their recent laboratory values were on, who they had seen recently, allows me to make an informed decision and keeps my kids happy because they're still on the sliding board while all that's happening. We're in the process of developing a whole suite of mobile applications, which you can see some of them up here. Many of them are self-explanatory. But imagine this scenario. When you walk into the Apple store, somebody greets you with an iPad and says, "How can I help you?" And somehow things magically happen, and then there's less money in your bank account, typically. Well, we want to provide value to our veterans when they walk into our medical center. Imagine if you walked into the atrium of a medical center and somebody greeted you with an iPad, asked if you'd like a flu shot, and they were able to take care of that entire workflow of documenting your consent to the flu shot, sending you the patient information handout about the flu vaccine, so when you got home and had questions about the vaccine you had just received, you would have that information available to you. We're able to administer the flu shot and document it in a way that went back into your electronic health record and was stored in one simple workflow. And that's the vision of how these mobile apps that are healthcare team-facing can really improve the efficiency of our care delivery. Patient-facing apps are, in my mind, going to transform the way our patients can engage with the healthcare system and are really a way to engage with a lot of the technologies you've seen here as well. This is what Aidan, when he was talking about kiosks, mentioned, that there's a lot of overlap between what we can do in mobile health with some of our other connected health technologies. Many of you may have heard about the VA Family Mobile Caregiver pilot, which is starting. Actually, this month we'll be distributing over 1,100 iPads to participants in the VA Family Caregiver program. And these iPads will come with a suite of applications. You can actually see all of those applications again at the table that will help caregivers of our most seriously injured and ill veterans to help manage the care at home, to manage the stress of being a caregiver, to communicate with a healthcare team, to record different values that they're tracking, like blood pressures, meals, activity, et cetera. And we're going to be releasing those applications on iPads that we will provide for a year to these 1,100 participants. And we'll be studying their effect to see, do these applications reduce caregiver strain? Do they improve the quality of care? Do they improve satisfaction and engagement with care, which is what we really care about? We also have several other patient-facing applications in development. One I'll highlight is a pilot that will soon be starting at several VA medical centers to allow patients to request their appointments and schedule appointments through a mobile application. Again, increasing their connection with their healthcare system, increasing their ability to receive care when and where they want it. Again, I just put this up here to show that we've spent a lot of time thinking about the technology behind this and the security. All of these applications are hosted in the VA's cloud. I also think it's helpful for some to realize that the cloud is not a cloud, but rather a bunch of buildings somewhere in the middle of Virginia surrounded by grassy fields. But anyway. And we're also developing opportunities to partner with innovators in the field here in the VA, and also with our private sector partners to develop applications within a standardized mobile application environment. So we're not reinventing the wheel. We're developing applications in a unified way as a team across the VA. All of the VA mobile applications will be certified. We've worked on developing branding for them so that they're recognizable. They'll be accessible through the usual app stores as a single application that we call the Launchpad. I'll show you that in a minute. And that Launchpad will allow veterans to quickly find the app that we've told them that would be good for them. We're going to make sure that these meet a standard such that veterans can trust these as apps that have evidence-based information and that we've tested them out to make sure that they're usable, et cetera. So I'm going to just spend a minute giving you a demonstration of a few of these applications. These are applications that are part of the VA Family Mobile Caregiver Pilot. In the upper left-hand corner, you see the Launchpad app. The Launchpad app is the app that veterans would go to download from the App Store. And it serves as essentially a bucket where we can provide them access to all of the VA mobile apps. This allows VA providers to give a single message: go download the Launchpad app, and from there you can get all of the VA resources. We can deliver both applications and web links that we think would be useful for veterans to manage their care. I can give you an example here of the Summary of Care app, and you'll see that when I click on that in the Launchpad, it just switches over to the Summary of Care. It allows a veteran to look at their demographic information that we have, their medical diagnoses, their allergies, medications. Allows them to look at their vital signs over time, what those numbers look like, their prescription data, their laboratory data, their imagings, and their progress notes. So essentially the data from their electronic health record on their mobile device. And let's just say that they realize that this medication needs to be renewed, they need some more aspirin. They can click on the Launchpad app, go right back to the Launchpad, choose prescription refill, and there's the list of their medications, single click, and that medication is on the way to them in the mail from our Consolidated Mail outpatient pharmacy. If they're tracking their blood pressures over time, they can come in here into the Journal app and keep track of their blood pressures. We'll be working on writing interfaces so that devices that collect this data automatically can enter that, or for now they can enter that manually. So again, a whole suite of applications to empower patients to take care of their health. In summary, you've seen a lot of great technology today. And I think one of the real themes that you've heard is that this technology can help enhance the relationship with our patients, which is really what healthcare is all about. William Osler, who is really considered one of the greatest physicians in US history, and then decided to go to Britain and became Sir William Osler, he once said, there's the great physician, it's the good physician who takes care of the disease, but it's the great physician who takes care of the patient who has the disease. And I would argue that in this modern day and age, it's actually the good healthcare system that takes care of the disease, but it's the great healthcare system that takes care of the person who has the disease. And these technologies allow us to take care of the people who have entrusted themselves to our care. Thanks.